Now, there's another type of, going back to the slides here, we've looked at the Federal Register. One particular Federal Register publication that you may be familiar with is the annual physician fee schedule that Medicare releases. So I'm on CMS's website, and I'll show you how I navigated to this page where we can find the final rule as well as a lot of attachments that tell us a lot of information about telehealth in the current year. So I start by going to cms.gov. I click on the Medicare tab, and I scroll down to the provider type. Even though it says physicians here, this is really professional billing. So if I click on physicians and I click on the physician fee schedule and I go to federal regulation notices, you can pull those. I'm jumping around on you. You can pull a lot of these Federal Register publications right from here based on the year. So if you want to know what was the rule last year for direct supervision of telehealth services, you could pull up the final rule, the F stands for final, for calendar year 2022. If you want to see what was proposed compared to what was finalized, you can pull up the proposed rule for 2022. The P stands for proposed and the F is final. I'm going to click on the final rule for 2023. And this page gives us, look at all of these attachments and exhibits of information that goes along with what we find in the Federal Register. The Federal Register itself is here, and I can click on that to open up the text of the Federal Register, where I can search for telehealth, or I can search for direct supervision and some of those key terms to read what Medicare said this year about what might be changing. I could read Medicare's explanation on any new services that will be covered as telehealth that maybe were not covered in previous years, or services that were proposed to be added to the telehealth list that were not added, and why Medicare decided not to add those services to the list of covered telehealth services. As you can see, it takes a while to load this document. It's often several thousand pages of information covering both telehealth and everything else that's changing for the current, the current calendar year. So while that loads, I'll go back to our main screen for the Medicare physician fee schedule for 2023. And there's another really important and helpful document in here specific to telehealth, and it's the list of telehealth services. This tells you each year services that have been added to the list of covered telehealth services for the Medicare program, and it will include that list here. I'll show you what that looks like. This is the Excel spreadsheet, and it will show you the codes that are covered as telehealth services, a short description. Now, I actually pulled up the 2022 list because the 2023 list, for some reason, does not include this, I think, very helpful information that we need to know right now as the public health emergency is winding down. Last year, Medicare gave us some really helpful information, like this code 0362T is a temporary addition on the telehealth list, meaning it won't be here forever. Once the PHE goes away, it will go away. I believe it's December 31st of 2023, the end of the calendar year when the PHE ends. That would go away as a temporary telehealth list. It tells us for certain CPT codes, could that particular service be rendered in an audio only format right now during the public health emergency? Because remember, the regulation normally outside of the PHE defines interactive communication systems as audio, visual, live, two-way real-time communications. So this is a temporary flexibility for certain services that could be rendered as audio only right now during the PHE. But this is a great spreadsheet to refer to if you're on this website each year to look and see. It's a quick way to see what telehealth services have been added to the list. You could also come to the Federal Register and do a keyword search for telehealth, but I'll let this kind of run up and you can see there are a lot of entries, a lot of hits with the word telehealth. It's mentioned 421 times in this document. So if you wanted to see what happened in 2023 with telehealth, you're going to be spending a while. Oh, it's still going, 580. You're going to be spending a while going through each of the instances of the word telehealth in this document to understand what has changed. You can navigate this for each year. You can go back and look and see what telehealth services were covered in 2020 or in prior years. Can't remember how far back this goes, but into the early 2000s, you can find that list of covered telehealth services. Now I'm on a different page of the CMS website, and you'll have a link to this in your materials as well, but this is just sort of a telehealth homepage, if you will, for CMS, giving you links to a lot of different locations. The physician fee schedule, that's what we were just looking at. HRSA's Medicare Telehealth Payment Eligibility Analyzer, which is where you can go in and enter your geographic location, like by zip code, and it will tell you if you fall into a rural geographic area, the way Medicare defines rural for telehealth coverage outside of the PHE, or a healthcare provider shortage area, the way that's defined outside of the PHE. This is also where you would go to submit a request that Medicare consider adding certain services to the list of covered telehealth services, that spreadsheet that we were just looking at. So you can submit a request here. There's a request for addition that gives you, let's see, I think it tells us the date somewhere in here. It's February 10th, I believe. Tells you how to request that addition and the criteria. This is extremely helpful if you are submitting a request. And again, by February 10th, we're past that deadline for this year to be considered as an addition for next year. But if you wanted to be doing that in the upcoming year for consideration in 2025, look at the criteria that causes a service to be potentially covered as telehealth and explain in your request exactly how that code or that service meets either category 1 and or category 2 criteria. Every year when I'm reading the Medicare proposed and final physician fee schedule, Medicare says they received requests without any additional information. It just says we want you to cover physical therapy as a telehealth service. And it doesn't explain, the request didn't explain how that service meets category 1 or category 2 criteria. So don't leave that up to Medicare to guess if you want to submit that request. I'm going to switch over to another Medicare. This is still looking at the federal level, another Medicare telehealth resource. Now, this one is focused on policy changes related to telehealth during the public health emergency. And CMS and HHS have been working on putting together a sort of roadmap to help providers with the wind down after the public health emergency ends, effective May 12th of this year. And so what you'll see on this page, and this is the questions that I'm getting most often for telehealth right now are, what goes away May 12th? What flexibilities will go away? What flexibilities will continue for 151 days after the PHE ends, or through the end of this calendar year, or through December 31st of 2024? This page is Health and Human Services starting to compile certain flexibilities that were made permanent, certain flexibilities that are temporary through December 31st of 24, through the end of the PHE, et cetera. So I think this is just a really helpful guide to help you navigate when some of those changes will be going away. For example, a permanent change for FQHCs and RHCs is that they will be eligible to serve as distant site telehealth providers specific to mental and behavioral health care services on a permanent basis. Now, outside of those mental and behavioral telehealth services, their ability to act as a distant site telehealth provider at this time would go away December 31st of 2024. So you have to be aware of some of those caveats and nuances too. So that's sort of an orientation to some of the key resources that I am visiting all the time when it comes to looking at telehealth changes and policy, and now the PHE wind down.